Good afternoon, I'm Michaela Miller with the Monday edition of the Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. We encourage you to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers and our audience. We want this program to be a two-way flow of information, so please get in touch with us. Today is the first working day of level 4 since President Cyril Ramaphosa eased South Africa coronavirus lockdown regulations. We will see thousands of returning to work. On Sunday, Labour Minister Thula Nxesi addressed the nation on the country's readiness, and we will show you highlights from that address. We also spoke to Chris Nissen, the Commissioner of South African Human Rights Commission, to find out more about an investigative report submitted to the South African Human Rights Commission concerning the City of Cape Town's COVID-19 shelter for street-based people in Stamfontein. And now for the news. It is day 39 of the national lockdown, and the current number of confirmed cases of COVID-19 nationally stands at 6,783, with 2,549 recoveries and 131 deaths. In the Western Cape, we have 3,113 confirmed COVID-19 cases, 833 recoveries and 58 deaths. Three more people have tested positive for COVID-19 in the Western Cape correctional facilities, with the total number of cases now standing at 44. Two of the new cases are inmates with Voorburg, Worcester and Allendale, each having recorded infections. Department of Correctional Services spokesperson Singabako Malo said healthcare terms were on site wearing appropriate personal protective equipment, including goggles, gloves, masks and gowns. They were rendering care services to distressed cases and monitoring those likely to develop acute respiratory challenges. To date, the Western Cape has recorded 3,113 confirmed cases of COVID-19 infections. A group of travellers caught moving between the Western Cape and Eastern Cape in taxis without valid permits have been placed in quarantine at the Mbukweni Beach Resort near Port Alfred. But according to an employee, police were called to help contain the unruly passengers who refused to stay in their rooms and behaved as if they didn't understand why they were there. Local residents are concerned that infections could increase between the provinces, as the Western Cape is the current epicenter of the virus. Western Cape Premier Helen Windy said joint police operations between the provinces were planned to control movements. 5 suspects were arrested in Makassar on Sunday for being in possession of suspected stolen goods to the value of 15,000 rands. The men were approached by Metro Police and a pursuit ensued before the suspects were apprehended. For SAPS, here is Surgeon Ruth Solomons with more.
Yesterday afternoon around 14:15, Metro Police officers attached to the K9 unit arrested 5 suspects for the possession of suspected stolen goods and reckless and negligent driving in Makassar. A bystander told officers that 2 men who were walking close by had been involved in a robbery at a clothing store at Somerset Mall. The officers approached the 2 suspects, but the men jumped into a light blue Toyota Corolla, resulting in a chase along the N2 direction Cape Town. During the pursuit, the vehicle occupants started throwing items of clothing out of the window. The vehicle was cornered in Makassar. The officers collected all the clothing items valued at approximately 15,000 rand. The 5 suspects between the ages of 22 and 26 were detained at Makassar SAPS for further investigation. This is Superintendent Ruth Solomons, Metro Police Media.
30 emergency medical services workers based in Khayelitsha have accused the health department of putting their lives at risk by not providing adequate personal protective equipment. The EMS crew downed tools on Saturday, resulting in the department having to call in paramedics from the Winelands and Helderberg to assist in the area. We spoke to the Western Cape EMS Director, Dr. Shaheen de Vries, about this matter.
We really don't understand the concern. The staff are claiming that they have no adequate PPE, and that's where the disagreement comes from. Department guidelines have been published. They're supported by the evidence, in keeping with international guidelines. However, they are deemed insufficient by the employees and have thus taken it upon themselves to resolve this. Yeah, I mean, I think that's absolutely, I mean, that's an issue. The Eastern Division is one of 4 divisions across the city. In particular, they serve the area of Khayelitsha and Macassar and Strand. The actions therefore taken by the staff has significant impact on those services being rendered there. We are and have deployed resources from across the city to serve that need. But obviously this places huge strain across the entire platform.
Now it's time for an ad break. We'll be back shortly. Welcome back. You're still watching the Our City COVID-19 show with me, Michaela Miller. We will be giving you the latest updates of the COVID-19 pandemic and sharing essential resources and information with you. The 1st of May marked day 1 of level 4 lockdown restrictions. More and more people will be returning to work under this level, along with easing of level 5 restrictions. On Sunday, Labour Minister Thulas Nxesi briefed the country on back-to-work readiness ahead of the first working day of level 4 lockdown.
Every employer must do the following: notify workers of the contents of the direction and how it will be implemented. They must inform employees that if they have COVID-19 symptoms, they must not be at work and grant paid sick leave or apply for COVID-19 TERS benefits. The employer must appoint a manager from within the existing structure to address the concerns of the employees and workplace representatives. This must take measures, or they must take measures, to minimize contact between the workers and between the workers and the public to prevent the transmission. They must minimize the number of the workers in the workplace at any time through shift or working arrangements to achieve social distancing. The employer must provide employees with information concerning COVID-19 and how to prevent its transmission. They must report any diagnosis of COVID-19 at work to the Department of Health and the Department of Employment and Labor, investigate the cause and take appropriate measures. It is a contravention not to do so as an employer. They must support any contact tracing measures initiated by the Department of Health. With regard to social distancing, workplaces must be arranged to ensure a minimum of 1.5 meters between workers. If this is not practicable, physical barriers must be erected and workers must be supplied free of charge with the appropriate personal protective equipment, the PPEs. Social distancing must be implemented in all common areas in and around the workplace to prevent crowding, including working spaces, canteens, meeting rooms, etc. in relation to screening, employers must screen workers for symptoms of COVID-19 at the time that they report for work, namely fever, cough, sore throat, redness of eyes or shortness of breath or difficulty in breathing, body aches, loss of smell or loss of taste, nausea, vomiting, diarrhea, fatigue, and weakness or tiredness. Workers should immediately inform the employer if they experience any symptoms whilst at work. Not doing so is a contravention of the Occupational Health and Safety Act by the worker. For the housekeepers, domestic workers, and construction workers, I have with me the Government Gazette, which was issued, which lists a number of sectors who are supposed to be going as from tomorrow, but it's partial, under construction. It lists the civil engineering for public works projects, including water, energy, and sanitation, public works, civil engineering, and construction work, road and bridge projects, including local road repairs, critical maintenance and repairs. So if that construction worker belongs to this, therefore, they qualify. But we must emphasize, they must go into sites which have been properly prepared. We need a plan from the employers. We would expect that a number of the employers might spend part of this week doing what is required for them. And then the other aspects talks to the domestic workers, the households. It's here, it's listed, the private households, employment, live-in staff, and I emphasize live-in staff, and staff providing care to the sick, mentally ill, elderly, and people with disabilities and children. They have been included. So if you are a domestic worker living in, you have been covered.
The Strandfontein camp for homeless citizens was set up as South Africa was going into lockdown, and all citizens were required to stay at home except for essential services workers. In a statement issued last week by Mayor Dan Plato, the City of Cape Town said it was providing reintegration, reunification and shelter placement services to every homeless person at the emergency shelter willing to accept this offer. Plato added that he was taken aback by what he called shocking falsehoods contained in a report by some members of the SA Human Rights Commission's Advisory Committee, which was released directly to the media. We spoke to Commissioner Chris Nissen to find out more about the independent report submitted to the South African Human Rights Commission.
Good afternoon, Commissioner Chris Nissen. Thank you very much for joining us here on Cape Town TV. Commissioner, you're part of the Human Rights Commission, and as we were talking now, you said the Western Cape is very busy. We know that the Strandfontein camp for homeless and vulnerable people was established just as we were going into lockdown. And there were some reports that have surfaced that the camp that was established was inadequate in terms of social distancing. There was limited access to health care, limited access to pre and post-natal care, and even allegations of sexual assault. Commissioner, what has been the investigation of the Commission? What have the findings been?
Yes, good afternoon to you and good afternoon to all the Cape Talk and the Cape TV. the Cape TV viewers. And please continue to support this television because it does help spreading the message and changes people's life on the Cape Flats. Let me say, in terms of the national disaster regulations, the state has the obligation to take people off the street, those who are displaced, and put them in a safer space where they can be healthy and protect them against the virus. The city of Cape Town have earmarked and put in place a facility at Strandfontein sports ground. And despite the limitations to it, as a commission, we said we will support them in exercising their constitutional obligation, and that is to keep the displaced people safe. And at the beginning, there were many teething problems, such as the lack of blankets, the lack of sanitation, the lack of mattresses to sleep on, and there were too many people in one tent, and so no social distancing. And so we felt that while supporting the initiative, we need to dig deeper in it, and therefore a group of independent professionals from Doctors Without Borders, psychologists, environmentalists, and some community activists went and did an independent assessment and made certain recommendations, including a recommendation that over time that there must be decommissioning of the camp. We had two positions. We support the initiative, but we also retain the right to criticize and point out in our observations where there is in terms of the optional protocol in the prevention of torture, cruel, inhumane, and degrading treatment, to show if people's dignity has been violated and if people are being treated cruelly, and also to listen to the alleged complaints that people have. One of the things at the very, very early stages, which we reminded the authorities, both at the camp and publicly, is that, for example, for a long time, people did not have toiletries. 2 weeks almost. And also women complained to me, and I felt very humble and small and very kind of angry at the same time. When people complain to me, they do not have access to sanitary towels. That is inhumane. And so we are saying that we support the city in its constitutional mandate, but we take the right to differ with them when we see that people's humanity has, and dignity has been violated.
So, Commissioner, the essence of the investigation is that while the city may be adhering to their constitutional obligation, there has been the impeding of people's dignity and basic human right to access things like sanitation, etc. We're getting reports now, Commissioner, as I was preparing for this interview and asking community activists who are supporting some of the community systems engagement, that people are leaving the Strandfontein camp. Is this correct? And if it is, do you know why they would be leaving?
Yeah, before I answer that, let me just say when the report was done and the subsequent observations made, we've always informed the camp site manager about our observations and what can be improved. And since that time, some things have improved, but there's been other problems that have cropped up. For example, that after 4 o'clock, there's no medical facilities for people because then the medical staff, the health staff goes home. And if something happens in the tent, then they have to call the ambulance. And the ambulance take a long time to come. And so those are the kind of things that people, the monitors subsequently have pointed out to them. May I also say that earlier today, one of the council members have accused us of leaking the report. We've never leaked the report. And we have sent the report on the 24th of April, both to the mayor and Richard Bosman, the executive director, because every time when we get to the camp, they say he's in charge of the camp. That's why I have made arrangements to meet with him. Today, our monitors are telling us that earlier on, about 150 people came to the main gate. In other words, they left the camps, the tents, and they came to the main gate and said they wanted to leave. And then, obviously, after some time, they are now in the open street. And obviously, we are very concerned because people are left and that they are now on their own. Because they don't know where they've been properly screened. And why is the city not taking them to other safer places?
Yeah. Commissioner, the second question I want to ask you, because clearly that site is one of very few sites in the city that have been provisioned for people who are extremely vulnerable and don't have set accommodation. What do you say to the recommendation that there needs to be maybe micro sites in communities where homeless people call home, which homeless people call home? And I'm thinking of communities like Muizenberg, like Plumstead, where there are homeless people who live there, even if they live on the streets.
Yes, it goes back to what I've always been asking authorities in this country, both locally and nationally. I think we do not have a sustainable policy framework to deal with homeless people. And we're just seeing homeless people as a nuisance, beggars, and we name all sorts of names to them, call them very derogatory names. And we have not been able to really find a sustainable solution to how to deal with displaced people. And I must say there are a lot of institutions, homeless organizations and networks that have done a lot to help and assist displaced people.
We now continue with part 2 of the interview with South African Human Rights Commissioner Chris Nissen. He spoke to Helga Jansen-Dauber about investigative report called Independent Report submitted to the South African Human Rights Commission concerning the city of Cape Town's COVID-19 shelter for street-based people in Stamfontein.
Commissioner, before you go, I know you probably are going to be inundated in the next few days around this very issue. One question I do want to ask you, it's a legal question, is as we go into level 4 and the curfew regulations that are going to be part of the way of life now, what about homeless people that may have left the safe spaces like Stamfontein and now are on the street? What advice do you have for law enforcement, for SAPs, and even neighborhood watchers in that instance?
Yeah. The United Nations on a committee against torture, which I'm the South African part, we call it the OPCAT, Optional Protocol in the Prevention of Torture, Inhumane and Cruel Treatment, has just brought out a document for us to, we call it advisory note, that we have to watch places of detention. And so we will be inviting them, but we will be observing them. But one of the things they say the virus is the problem, not the people. The virus in this country is the enemy, not the people. And so we must treat people with respect and dignity. If I drive down Cape Town at the Greater Metro, we still see people living on the street. I'm asking how many people have they taken, how many people have been left behind? Because some of the people are still around here in the city. And so we're asking people, the law enforcement agencies, where they find people and people are not a nuisance, and people are not a disturbance, and people sit in their places where they are. If they're not in a shelter, take them to a shelter, but if you can't take them to a shelter, please treat them with respect and dignity. They're not enemy. The COVID-19 coronavirus is the enemy, not the people. And
Commissioner, I suppose the sentiment that you've just shared with us now, that it is the virus that is the enemy. We are not each other's enemy. Is that a kind of sentiment that you would also share with the community of Stamfontein and the Ward Council of Stamfontein, who have initially been opposed to this camp being established in the neighborhood?
Absolutely. And I was saying this to many people all the time. You know, all of us, it doesn't matter where you find yourself, all of us have somehow a relative or a friend that's homeless. Many of us do have family members and friends that are homeless. And we too can become homeless tomorrow. Because homelessness is not something that people choose willingly. People fall on hard times. And that's why we are saying to all communities, please, when people are there, treat them with respect and dignity. But be vigilant as well, because some of the people have their own agenda amongst the homeless people. But I think the Strandfontein community's problem is a real problem. Why wouldn't they consult it?
We are now taking a short break. When we come back, Octavian Glover will update us on the latest social media.
Welcome back. Before the ad break, we had Michaela Miller with the latest news. In the following public service announcement, the Executive Director of UNICEF, Henriette Fore, speaks about the impact of COVID-19 is having on children and women around the globe.
Today, the Secretary General released a new report on the impacts of COVID-19 on children. While children have largely been spared the direct health impacts, they face catastrophic effects from the unprecedented measures to contain it. Physical distancing and the shutdown of businesses and transportation systems are fueling what could be the worst economic crisis since the Great Depression. As the IMF recently reported, global income is expected to contract sharply this year. This could throw 100 million more people into extreme poverty around the world. In short, the poor will grow poorer, and the ranks of the poorest will grow larger. Children's health will suffer as systems buckle under the strain of COVID. Their nutrition will suffer as the cost of food goes up and families struggle to get by. 1.5 billion children are out of school, threatening their futures. They face mental health issues as the stress and worry of their families spread to them. They're threatened by potential abuse, violence, and exploitation in their homes and online. Girls and women are particularly vulnerable, facing rising threats of violence, teenage pregnancy, and even child marriage. And the children living through conflicts are at a double disadvantage, as already weak health, education, and social systems are shattered by both the fighting and COVID-19. But the report also offers recommendations on what we can do as a global community to help children and communities recover, like the rapid expansion and scaling up of social protection systems like cash transfers to support families at this difficult time, like urgent investments in health systems to ensure that basic services like vaccinations continue, like nutrition strategies that ensure a steady supply of food, like declaring core child protection services essential, and like tailored strategies in communities where physical distancing is impossible, in crowded slums or refugee camps, to help speed up the pandemic's end. Together with UNICEF's Agenda for Action, which we launched last week to keep children healthy, safe, and learning throughout and beyond this pandemic, this new report reminds us that it's not too late. If we act now, we can support the world's youngest citizens through this crisis and help their communities rebuild, recover, and rebound from the worst effects of COVID-19.
And now for social media. Share your thoughts with us. We're on Facebook at Our City CT and on Twitter at Our City CT. This is a time we need to come together as a nation. These are the popular hashtags on Twitter today. SASSA, thousands upon thousands of citizens are queuing for their social grants today. Despite a promise from the agency that queues would be managed to ensure their safety, images show otherwise. Many are sparing a thought for the at-risk elderly who are lining up for grants to help feed their families. Nkosazana Dlamini Zuma. The Kokda minister is under fire from all directions, but especially over the continued ban on cigarettes. Big Tobacco, civic societies and business plan to take the matter to court. After the ad break, we'll be crossing over to Michaela Miller, who will share information on resources and places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show with me, Michaela Miller. Before the ad break, Octavian Glover looked at what has the nation buzzing on social media platforms. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune into Cape Town TV Daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via our email on ourcity@capetowntv.org. You can also call on from me, Michaela Miller, and Octavian Glover. Goodbye.